I was your typical teenage male, you know. I enjoyed watching sports all the time, hanging out with friends, going to school. It was the summer before my senior year, so I was starting to look at colleges, and this just kind of came out of nowhere and interrupted all that.
In July of 2006, he wasn't feeling well and kept complaining that his bones were aching and that his cheeks hurt.
I was just tired all the time, and normally I was really energetic and upbeat, and I just wanted to sleep. Like, I'd wake up from 10 hours of sleep and want to take another nap. We ended up going into my doctor and actually getting blood work done, and that's when we found out.
He came in and said, "It is cancer, and you need to get him to the hospital."
When the doctor told me I had cancer, I was unsure what to say, because I just lost both of my grandfathers to lung cancer, and I didn't know very much about it, and I just assumed it was a death sentence.
I said, "Cancer? How could he have cancer?" And he said, "He has leukemia." We started at a different hospital, and a friend of mine called me and said, "What are you doing there? You need to be at the med center." We had an appointment with Dr. Bruce Gordon and asked some questions and decided that yes, this was the place that he needed to be.
They went with more intensive rounds of chemo for it because I was younger and they figured my immune system could take it. There were a couple problems. I developed a yeast infection at one point in my lungs that almost took my life.
Getting the call at midnight, "Luann, you need to come to the hospital, he's really sick." And you can hear him in the background yelling, "Mom, please come." And he has pneumonia on top of everything else that goes on. So with everything that went on, needing a little quiet time and a little God time, I would come and spend 15 or 20 minutes praying that Alex would survive and that we would all three be able to make it through this really bad time. And I know that with God's help, he is where he is today. And I continue to thank him every day because Alex is alive and well.
It was the best care I could have asked for. Dr. Gordon was an absolutely excellent doctor. He was upfront and honest with me at all times, and he was still always upbeat about it. Like, it was never something we couldn't do. It was always something that we were going to beat and it was going to happen. And just his sense of humor at times was it was great.
He told Alex that when they put the anesthetic in, if he could count to 20 before going under, he would buy him a Porsche. So he did it. And then Dr. Gordon came in and said, "You know, Alex, I heard that you counted forward and backward." He goes, "I have your Porsche."
I did. I gave him a Porsche. I didn't mention that it wasn't going to be a full-size one. It was going to be a Matchbox car, but I gave him a Porsche.
We still laugh about it. We still have it.
The most important part of my job is communicating with patients and communicating with parents. The treatment, while it's clearly important, I don't make that up myself. I follow protocols. And so I like to say that a chimpanzee could just give chemotherapy. You follow the protocol. What we have to learn, I've taken 25 years to learn, is how to talk to people and how to sort of respond to their looks and respond to their body language. The hardest part of this job is dealing with a kid who you've just changed their life and a whole family that you've just changed their life. Whether it's your fault or not, you were the one who said the word cancer to them. And now you've got to work with them within that context, and they've got to live within that context, hopefully for the next 90 years, but it has changed their life.
The nurses, Lindsay, Tammy, Katie, Pam, all of them they almost became like a second family, because when you can't really leave your room, you have to talk to anybody, and they were just so understanding and so nice about everything. It was fantastic.
I remember Alex and his family like they were here yesterday. I remember just sitting down on his bed with him, telling him two things. The first was, "Do you have unlimited text on your cell phone?" And the second one was, "Sorry you got dealt these cards, but I'll teach you about the cancer card." As our relationship developed and he wanted something, I'd tell Alex, Now is when you pull the cancer card, buddy. So whenever Alex wanted something during his fight, he would say, I pulled the cancer card, Linz. It's no secret that I love to laugh, so if I can make them comfortable by laughing with them or making jokes out of things, then by all means we're gonna do it. If I accidentally squirt you in the face with the saline syringe, oops. Not very many people get to wake up and kill cancer. We're kind of like superheroes of the nursing world because we get to kill cancer. That's a powerful statement to make, and I don't take it lightly. You know, I get to walk into a building every day I work where miracles are happening, and that is exciting.
The experience of the 7 months, it was like nothing I had ever experienced. The rapport that you can build with the people in this hospital, I didn't feel that at the first place that we were at.
With the care I got there, it gave me a better prognosis. It gave me a better chance looking forward that, you know, I can look to my future and not have to worry all the time about it coming back. I will be graduating in May with my degree in accounting from the University of Nebraska at Omaha, and I will be applying to law schools this fall, hopefully. I just want to sincerely say thank you to everybody at the Nebraska Medical Center for everything they've done, all of the nurses, doctors, patient helpers, just everybody. It was fantastic. It was a horrible experience, and they helped me through it.
The care that he got was extraordinary.